Well, I'm delighted to talk to you a bit about this Oncology Translational Research Consortium. It's one of several of these consortia that have been put together under the umbrella of the NIHR, which is funding for research across a whole range of diseases in the UK, particularly in England. And these have covered things like musculoskeletal disease, cardiac disease, respiratory disease. But there was a feeling that what may be worth doing will be to put this together in the field of cancer. And we started the conversations a couple of years ago. You see, what the NIHR funds are what are called biomedical research centres, and there are a number of these across England, a defined subgroup of which focus on cancer. And we felt that when we got together that there was a potential for us to really work together to fill in some of the gaps that we felt were present in what's called translational research, that is taking the best of work from the science and the laboratories into the clinic. That's not to say that in the UK there are not already existing very effective networks in cancer research, but taking the expert view together, we felt that it would be possible to add to that. So it's important, I guess, to emphasize at the beginning that the oncology TRC is not going to replace anything that's there at the moment. It's going to add to that. We hope it will, because it's an early stage. And what we've done is to get, I think, the right people together in the room to make some plans. And we'll see how this goes over the next 2 or 3 years. What we identified when we looked at cancer was that we could identify 4 areas where increased collaboration across these BRCs and actually in other people, we weren't going to be exclusive, but 4 areas where we felt there were gaps that could be filled that would make a real difference if we could put together successful collaborative plans. And we're going to be starting this year. For the first one, maybe I could say a little bit about is early diagnosis. It's a prime issue in cancer, and we know that the problem with cancer is that not enough patients are being diagnosed early enough. And the target set by the NHS, in fact, is to increase the number of patients diagnosed with early cancer to 75% by the year 2028, a really ambitious target. And there are all sorts of ways that could be addressed. But what we're going to try to do is to add to that by putting in place some research proposals. And the one that we think might work best is around something called rapid diagnostic centres, so-called RDCs. These are being put in place across the country to try to improve the speed with which patients with suspicious symptoms get into the system and have their cancer diagnosed more quickly. And there are various research questions that could be addressed looking at new forms of diagnosis, including blood samples as well as others. That's a program of research which I think will involve many of the centres I've talked about. Second would be surgery. And the surgeons who I've been in touch with and have set up the surgery work stream are focusing on 2 or 3 areas. One is precision surgery. There are lots of novel techniques that might well improve the way that surgery is done, to improve the accuracy of the surgery using novel forms of imaging. Another stream within surgery will be so-called prehabilitation, which is where patients who are due for radical surgery have their condition improved by a variety of techniques, including dietary and behavioural and other forms of support. And that actually covers an area that's not restricted to surgery, in fact, but patients who are having extensive treatment such as chemotherapy and radiotherapy. And there are other streams in the surgery stream looking at how to optimise patient consent for various surgical trials is another stream. So that's early diagnosis and surgery. The third one is radiotherapy. Radiotherapy is a key part of cancer treatment, and there already exist in the UK networks for radiotherapy research. And we're going to add to that by looking at a specific question, and that is, to what extent can one predict and therefore prevent how much side effect toxicity patients have when they have radiotherapy? And that's going to be done by very sophisticated examination of imaging led by a group in Cambridge, but involving sites across the country. And I think that's going to be really quite important because the toxicity that patients receive as radiotherapy regimes change is a real issue. And the final one is immunotherapy. And this is a new form of cancer treatment, which is certainly making an impact in a range of different cancers. And I'm sure that's something that people are increasingly aware of. It's really moving away from conventional chemotherapy. The challenge with that is that as one gets into more complicated treatments, it can, again, causes more side effects. So the balance between side effects and efficacy is very important. And the work stream working on immunotherapy is looking at ways of predicting who may be at greatest risk of developing these severe side effects and thereby working out ways to prevent them. So those are just examples. Those are the 4 work streams that we've set up. It's not exclusive. We'll be getting going obviously this year, but we want to be very open to other ideas. The bottom line is that these experts, it's not me, but I'm a medical oncologist. I'm not an expert surgeon or radiotherapist, but we're taking advice from the best, I think, groups in the country to say over the next few years, what are the ways that we can add to the existing research in the country to really make a difference to patient care?